Hi, good afternoon. Um, so my name's Paul Keeley. I'm a consultant in palliative medicine, and I'm also associate professor at Glasgow University. And I run with my co-conveners. I run the my fellow conveners, um, Joe Prentice and Cath McCallum. I run the well, we run. I say we run. I say we provide the content. We have an excellent team of staff who work with us who actually run things because they are much more efficient than I am. And I won't apply that to Cath, who's here. So Cath, can I let you introduce yourself as well?
Perfect timing, just as I was taking a swig of juice.
Sorry, that was very mean of me.
So yeah, my name is Cath McCallum. Just in terms of my background, my trade is that I'm a GP, but I've wanted to do palliative care forever. So as soon as I completed my GP training, I started a job in a hospice just outside Johnson, so just outside Paisley, essentially. And I joined the team for Glasgow Uni 2 years ago. Initially as Joe's mat leave cover, and then they kept me on. So I am
Became so
working my way up,
indispensable.
working my way up to. I'm currently working on my own masters as well in education. So hopefully be able to continue teaching in palliative care as well.
I'm assuming the other Joe here is not Joe Prentice. You can speak for yourself. So
Hi, sorry, yeah, I need to
yeah.
stop my audio working. No,
So
hi,
I thought our colleague Joe, who unfortunately can't join us today, had joined at the last minute, but she's not. So I'll introduce her. Joe is also a convener on the course, and is unfortunately otherwise occupied today. So otherwise she'd be here. The other people I should introduce are Craig and Anne, who are together and up in the top right-hand corner. So, Craig and Anne, could you introduce yourselves as well?
Hi, I'm Craig, and this is Anne. It's not the other way around. And we are current students on the program. I'm a palliative care doctor in South Africa, Johannesburg, where we are at the moment. Anne has come to visit me here, and you can introduce yourself, I think it's...
Yeah, okay. Yeah, so hi, I'm Anne. I live and work in Switzerland, practice specialized palliative care nursing in Switzerland, initially in the acute hospital, and now I'm in the community making house visits. And yeah, coming to South Africa to be with Craig to find out what palliative care is like in the South African context, and yeah, work a bit on our masters.
They've made us very envious because the pair of them are in the most gorgeous part of. Am I right? You're on the western coast of South Africa at the moment, in a beautiful coastal village.
We will be. At the moment, we are in very much central South Africa, in Gauteng, in
Right.
Johannesburg.
Okay.
And from Saturday, we are going to the Eastern Cape, where we are staying on the coast, in Kenton-on-Sea, and then to my hometown, which is Paternoster on the west coast.
Yeah, which has beautiful white houses that looks like something out of the Greek islands. Yeah. So I'm afraid we can't offer that as a service for anyone who joins the course, that they will have instant access to beautiful writing places on the western coast. What I was going to do was quickly go through what the program is, and then I'm going to pass on to Craig and Anne to give their experiences. I'm slightly nervous about that because they may reveal the complete truth about what I'm like as a teacher. I think they'll give a glowing account of Cath, but they might give me a bit of a kicking. So I'm going to share my screen now. So I've got some slides. The material will be familiar with you, to you, because if you've been on the course website, you'll have seen much of the themes. But I want to just go through and give some detail to what's going on with the program and how it runs. So I'm just going to share the screen just now and go through the slides. So the postgraduate taught program in palliative care at the University of Glasgow was started in the middle of COVID, unfortunately. It had been planned for 2 years before that. So the university had identified the need for postgraduate taught program that would be delivered online, which worked remarkably well, as you can imagine, with a population of students who were holed up in the midst of COVID. Oops, I'll just move that slide on. So from the beginning, which was largely based on conversations in a cafe in the West End of Glasgow, we felt that there was a need for an emphasis on learning embedded in clinical practice. So we are clinicians. Cath and Jo and I are jobbing palliative clinicians as well as educators. And our aim was to ensure that this was clinically embedded teaching, that a program that was really grounded in how people work in palliative care. And we wanted to cover a range of things, so symptom control, communication skills, patient-centered care, and leadership and effectiveness, to try to give a breadth of experience and learning for people who were wanting to develop their careers in palliative care. And we wanted to do that by drawing on our own experience as clinicians, but also a wide range of clinicians who very helpfully offered to be involved in teaching. So we used the experience and skills of our fellows in Glasgow and beyond Glasgow who wanted to collaborate in this program with us. As I say, we planned that from 2018 and started delivering that in 2020. So our aim is to deliver teaching through using the experience of skilled palliative care clinicians, and we wanted to use a range of teaching approaches and assessment approaches that beyond just ordinary lectures. So we tend to use a combination of lectures and seminars and online forums to deliver teaching in a way that people can fit in with their lives. This is an international program, so we've had students from Hong Kong in the east to Alberta in the west, and that means that we have to have some flexibility about timings to make sure that people who are at very different ends of the time zones can fit that into their working lives. So we aim to be as flexible as we can, given that we've got an international audience, and that we're also conscious that there are people who are working who will have 9-to-5 lives, but also people who'll be working shifts. Our assessments are geared towards developing a range of skills. So some of those will be very traditional essays to be handed in. Last week we had what in my book is the best assessment of the year, the Death Book Club, where students go through a book of their own choosing and give an assessment of that, a critical assessment of that book, and present that to their colleagues. So the skills go from the very traditional academic to much more developmental and how can I put it, interactional skills as well. Don't worry about that, because everyone, I think I can say quite confidently, including Craig and Anne, are terrified of presenting anything in public, but you soon get over that when you have to do it. There are 3 exit points on the programme: a postgraduate certificate, which is 60 credits, so that takes in 3 20-credit courses, and I'll go through which those are in year 1. A postgraduate diploma, which takes 2 years and 120 credits, and again, I'll go through those, and a master's, which is 180 credits, so that's the year 1 and 2 courses, plus a dissertation that's presented to the university and examined as part of the examination process. That'll be a piece of original research that, and we had our first graduates on the programme last year who graduated in December. So Year one consists largely of based on symptom control, so but also a broad overview of palliative care. Themes in palliative care look at the origins and philosophy of palliative care, so to give an idea of where palliative care came from, what its guiding principles are, and to allow you to critique those. The second two courses are symptom control, which takes place in semester 2, which goes through in a fairly rigorous way, well, in a very rigorous way, we hope, an assessment of symptom control and develops some ideas of critical appraisal of the evidence on which that's based. So you'll be developing critical appraisal skills in assessing the clinical evidence behind symptom control within palliative care. The third semester course is one on holistic management that takes a wider view of symptom management and incorporates the spiritual, the psychological, and the social elements of care, as well as some more technical aspects of symptom management, including interventional techniques for pain and other symptoms. Year 2 is about developing you as a clinician, and that involves 3 courses, one on research methods for palliative care, which is really to prepare you for the dissertation if you go on to that, but also to give you an understanding, if you don't go on to that, of what research is, how it's conducted, and also the skills and ability to assess literature in a deeper way than is picked up in year 1. Clinical leadership and effectiveness is about developing you as a clinician to take on leadership. The point about a level 9 qualification, like a diploma in palliative care or a master's, is that you will be expected to develop yourself as a clinical leader, someone who's taking on the knowledge and skills that you pick up on this program. We hope will apply them in taking on leadership roles, in whatever that means in the future, and also effectiveness to try and get you to be a more effective practitioner and to develop you personally. And finally, advanced communication and ethics takes on those areas of palliative care which are perhaps the most important in terms of developing an ethical sense and communicating with patients. And that involves some very practical aspects of how we communicate and including a very practical assessment of that. The final year is palliative care dissertation. This can be a slightly scary year, as Anne and Craig might let you know, in that you're very much left to a certain extent to your own devices. There is supervision, regular supervision available and guidance, but ultimately this allows you to, our idea is that having developed the skills to be an independent practitioner and researcher, that by year 3, you should be developing research ideas and methodology, and a clear idea of methodology, and the ability to develop an original piece of research, which will hopefully be disseminated after its presentation and successful examination to become part of the evidence base for palliative care. The dissertations that we've had so far from the first 4 graduates that we had last year were an interesting mix, some involving qualitative, some involving quantitative methods, but very different methodologies in each. But they involved research on routinization within hospices and how that impacts on both patients and staff. A very original piece of advanced care planning, work on advanced care planning in dementia patients in Scotland, and how I'm conscious that piece of work is already being implemented as part of advanced care planning within Scotland, and in fact the student who presented that dissertation successfully last year has already been co-opted into doing work on advanced care planning at a national level within Scotland. The perfect discharge plan was developed by one of our pharmacology colleagues who graduated last year, and was an impressive piece of work that went through and a very practical piece of work that again has been implemented at a local level within Alberta for the better development of palliative care there. And finally, the dissertation from our colleague in Barbados was an incredible piece of work that went through. She's now the only person with a qualification in palliative care within Barbados, who delivered a dissertation 2 weeks off giving birth to her first child, which is the most impressive piece of academic work I think I've seen in all my days, to be quite honest with you. Added to which, she didn't tell me that she was 2 weeks off delivering her first child in the presentation of this dissertation, which is an incredible piece of skullduggery that kept me confused for some time. But that was again a great piece of work that again has been applied by and will be used to develop palliative care services within the Caribbean. I'm going to shut up now, and I'm going to ask first Cath if there's anything she wanted to add, and then I'm going to move on to Anne and Craig to give us their experiences of what it's been like being a student on the programme.
So I think first of all, it sounds daunting when you're looking at it, and when it's when it's all written down, it sounds like a lot. But actually, I'm obviously coming at it from the other perspective of teaching on it. It's actually really good fun, and it's so interesting, especially when you get discussions generated in tutorials or on the Teams forums. And even during, as Paul was mentioning, during the Deaf Book Club presentation, we had the second lot of that last week. And by the time we'd actually finished the presentations, I'd ordered a couple of the books online because of how well it was presented and all the discussions that came from it. So I would definitely say it can look a bit intimidating, but it's really, really good fun, and it's really interesting as well. That's just my threepence worth.
And then Craig, can I ask you? I'll mute, and can I ask you to give your impressions of how the course has been for you so far?
Sure, I think so far is very accurate, because I think we're both acutely feeling the end of the course looming, which feels unbelievable that it's here. But yeah, I put together just a few very quick thoughts, and then I'll hand over to Anne. I come from a very resource limited environment in South Africa, and I remember at some point having a discussion with Paul, who said, "I don't really know why you're doing the program, but we're happy to have you here." And I think so I thought it would be useful for me to initially say why I chose this program and why I chose to do a master's. Was within my context, as specialist medicine is quite gatekept by a master's degree, and generalists. We have undergraduate medicine, and people into a generalist practice quite. It's a fairly unregulated environment, and rightfully the specialists are quite wary of bad generalists, I guess. But so I went through a number of training programs in South Africa for palliative care, and trained at UCT with my postgraduate diploma there. And I found that I was still not quite at the level that I needed to be to converse with our excellent specialist environment here. And so I decided to pursue an MSc. We only have one Master of Philosophy program in South Africa at UCT, but having had studied there 3 times, I thought it was probably time for me to have a different set of ideas. And so I went on a sort of a journey to try and figure out where I wanted to study, of which there are many programs around the world that you can join. I chose University of Glasgow for a number of reasons, but two of the things that were important to me were diversity of thought and some sort of like I found that established programs can sometimes be a little bit clunky because they're too set in their ways, and I liked the idea that the Glasgow program was so new and adaptable. So I chose that, and then obviously I have full-time work here and required a bit of flexi time, and that really worked extremely well for me. In terms of the education that we've received up to this point, really very, very, very comprehensive, really broad, and I remember having a discussion, having taught at our postgraduate diploma here this year, in direct relation to my master's thesis. I had a chat with our only professor of palliative medicine in South Africa, Renee Krause, and I said, you know, I was kind of annoyed that I had to redo a postgraduate diploma, and I said to her that it was actually remarkable having done the postgraduate diploma in South Africa, which is extremely practical, not very sort of ground up. This is where we're at, and it taught some principles, but more practical management and going into the practice of palliative care. Interdisciplinary program, really lovely. But what I really appreciated about the Glasgow program was this sort of thoughtful initial phase of what is palliative care? Is it necessary? What is it about? And I remember the professor there, Renee Krause, said, "Well, we don't have time for that nonsense here," and it was so helpful for my growth. So yeah, the content really lovely, but I think importantly from an experiential point of view, I engaged more and less over the 2.5 years that it's been in my life. There were times where I was a pretty vacant student, and other times when I was extremely engaged, and that was really helpful that you could have that flexibility when it made sense in your life. You could really sink your thank you, Paul. We do have time indeed. You could really sink your teeth in when you had the time and capacity, but also it was okay to put it on the shelf for a little while. I myself, I took some lessons from my initial studies, and once or twice spoke with I didn't have a baby, but I definitely had problems, and the school was really adaptive to my needs, and so that was really helpful. I found the actual platform extremely accessible. The Moodle platform was quite different. I was quite used to the South African-based thing where each university had their own sort of unique site, and we made use of a platform called Vula in Cape Town, and that was a very, very user-friendly platform, and I was very wary to go into a different environment, and it was extremely user-friendly, more so, I would say, than what I'd been focused on before. I think one of the things that was a surprise, I entered into the program because of the diversity and the fact that it was an international program, and I wanted lots of new thoughts and ideas, and I guess that came from discussions and relationships, and that was great. But the content is necessarily quite UK based still, and that was helpful for me to learn a completely different environment. But then at the same time had the space to connect with new people, and Anne and I really connected in a wonderful way on the program, and sort of share experiences and contrast, and and I think that leads me really well to one of my favorite things of the program was connections and friendships that were formed. I mean, how many friends will fly across the world to come and sit next to you and experience a different place of care, and that's been super wonderful. I like the idea that if things went a little awry, I could exit at any stage. So you could, and we did have a number of colleagues who had intended to do the MSc and exited with the postgraduate diploma. All the better for it, I think, and for a number of reasons. And I like that one of the real challenges with the programs here was that you either complete or you don't, and if you don't complete, it's on a South African salary, it was a big deal to fund a UK-based program, and I was really happy that should things go badly, it would be okay, and I could exit with something to my name. And I liked the class size. It was really, I don't know what the intentions are for the future of this program, but I hope it doesn't get very large. It was nice to have a smallish class that we got to know our fellow classmates. In terms of workload, I found the workload very manageable. But again, you make of it what you will. You can probably coast through the program and do okay without learning anything, and come out the other side a very good palliative provider, or you can sink your teeth in and not have a clue what palliative care is anymore. And that's super cool. Like to be critical about that, and I really like that. And in terms of the sort of, my last thought was just around outcomes, apart from the relationships that were made through the program. My own master's thesis in South Africa has been, it's a unique topic here, and as a result, I have become somewhat of the queer palliative care expert, and it's quite special that you now get people asking about those things. And I've now taught in the program that's here, and they've welcomed the content into their program, and connecting with like-minded colleagues across the world. Just with the, I guess, when you've got such a recognizable theme, it was extremely easy to connect with like-minded colleagues throughout Europe and the UK, and be welcomed into those circles. And I've connected with the likes of Richard Harding with a single email and an immediate response of, "Oh my goodness, yes, we need some more," and sent me resources, and it was just so wonderful. And I think being part of a kind of an immediately recognizable program, people kind of, there's something about the UOG name that is really validating, but also, I don't know, we were encouraged to make our own project. I don't think there's anybody who kind of went in with a boring start. I think it was challenging that my initial idea was not quite right, and I ended up in actually a very comfortable place, after having been a little bit disappointed that I wasn't going to be able to conduct original research. And it pushed me into systematic review, which is actually something that I think is going to be better for me in the long run. Thoroughly enjoying it. Forced me to learn in vivo for the first time, 3 times at university, and never used in vivo. It was time. Anyway, those were my thoughts. Did you have any?
I think I can second everything Craig has said on many levels. Different. I chose to do this master's. I would have done continuing education in palliative care in any case. But in Switzerland, I did not want to do a Swiss program. Any palliative care education I'd had up until this point had been in the Swiss system, which is younger. It's a little more, I think it doesn't offer sort of as broad a perspective as an international online program does. And I'm very glad I made that choice. After 30 years between academic degrees, it was a challenge, but fabulous support in that challenge. Not always easy, but good. The relationships, super. And probably one of the best things I think we both agreed was not only professional, but personal development. As a practitioner, leadership, yes, but just in general, because it's such a deep and challenging field that generally tends to attract people who are very engaged and passionate about the subject. It affects you on many different levels. And I felt like there was really the space to develop that and work out some of the difficulties in working on that level. And just to add, in terms of connections and the possibility to take many of the things that we've learned and encountered, I think one thing we may be looking at is development of advanced care planning in a South African context, because it's much different than it would be in an American or a Swiss context in terms of speaking about death and advanced directives as a taboo subject, it's so across the board in South Africa in a way that's different from many other contexts. So incredible challenges and the ability to hook up with practitioners in different settings and find out what's actually possible. So that's been really brilliant. Exceeds expectations in all ways. The note of caution, I think my only note of caution about doing this program, if you do go on to the masters, and you will need your ethics committee approval. The earlier the better. That's not just a good idea. It's take that as a warning, as a threat and a warning.
Yeah,
Yeah.
I would completely emphasize what Anne has said, and this year's students going forward to next year have already been urged to get it in as quickly as possible. Ethics can be glacial, but we're hopeful that everything will be in place for this crop of students before they start going. I thank you both very much. That I'm slightly embarrassed by how nice you've been about us. I think one of the things I pick up from what you said is, Craig, that life intrudes, and that's been an experience that we've had, that we anticipated, and that things happen, and people get sick, or things happen, or their dog dies, or worse happens, and that we aim to be as adaptable as we possibly can. Interestingly, you mentioned obviously some students exited early. A significant proportion of those students who had to finish the program at one point have come back, and in fact there are a couple of students who are presenting their dissertations this year who took a year out. So the pace at which you can go in the program is, once you've acquired the credits that you need at one stage, they can be taken on to another. And at that point, Jo Prentice appears. So I'll let Jo introduce herself, and then we'll kind of ask any questions, and then finish up, if that's okay.
Hello there. Hi. I'm Jo Prentice, consultant in palliative medicine, and work with Paul and Cath on the master's program. Sorry, I just had a meeting, so very nice to meet you guys, and welcome to the afternoon. Good to see you joining us. Thank you.
So at that point, Cath, unless you had anything in addition to say, we'll probably take some questions. Jo, Cath, was there anything you wanted to add to my witterings?
No, but thank you very much for your glowing feedback, Craig and Anne. That was lovely. I'll definitely show that to Jo.
I might add for the record that they have not been paid for their contribution to this afternoon. Quite the reverse. Anyway,
I'm also clocking that you guys are together despite being normally so far away. Sorry, like it's a total brain moment where I just realised, unless you've got some very clever like AI knitting together, you are. Can I confirm you're in the same room? That's so cool.
We did actually want to do like two screens and then slowly come together.
That is so nice. That's fabulous.
So you see, there are international connections made on this program. I'm going to open up for any questions that anyone has. It's probably easiest if you can raise your hand, or just if you just raise your hand, and I can take them from there. So just if anyone has a question.
We do have some preempted questions as well that
okay.
we've had students send in, so I can ask them. You guys have done a thorough job at presenting the programme today, and it's so lovely to hear from Anne and Craig as well about your personal experience on the programme. It is honestly so lovely to hear, and I know that our students will be very grateful for it, so thank you very much. Anne and Craig, maybe you guys could answer this question. So the first question that we have is, what does a typical week look like on the programme whilst you're working?
There is no typical week. No, it's It's less structured than that. You've got a lot of room to, like you'll have to schedule a meeting in. You'll be given a schedule of meetings. If you can make it, then generally you're informed in enough time, although sometimes even pre-planning would be more helpful for those of us who have to have our schedules in very, very early. Then you meet up and you generally have enough time to prepare, but I don't think that there's no typical week or typical meeting.
I think I would go ahead and say it depends how far ahead the next assignment is due, because usually it means that for the first, 3 weeks of having the assignment that you do very little. And then a nice late night assignment. I always wonder if Paul and Joe were judging the time that I submitted my assignments, because usually it was submitted at about 2 a.m. And it was basically me saying, I will not work on this anymore. But yeah, I echo that. I don't think there's a standard week, and again, highly variable, adaptable. I'm an independent practitioner, so I can really schedule my time quite extremely. But I think if you do have a more shift work and difficult to schedule times, then it's definitely doable. But you'll have to be more organized than I am.
That's excellent. Thank you. Paul, did you want to add something?
No, just to say that it's not done deliberately to disconcert, but it's largely because the themes that are developed over, certainly between year 1 and year 2, I think the modules within year 1 and the modules within year 2 probably do have some relation to each other significantly, but the focus, the assessments, and the learning methods do change, and that's partly because we want this to be as varied a program as possible. I have to take credit to the educational genius of my colleague, Dr. Joe Prentice, for insisting on that, and I think it's worked over time, in that we felt that different people learn differently, they all have different needs, and we as developing a program. And this is a developing program because what we take from year to year, we review everything to make sure that the learning is as up to date as it can be, and that it's as relevant to people. And we take as much feedback as we're able to get from students to make sure that from year to year it's meeting their needs. So everything that Anne and Craig have given, and Anne and Craig are unusually participant and active members of the learning community, and what they tell us will be put into practice, because we want this to be as adaptive as possible as a program, to make sure that we're not just setting something in aspic or stone and that just becomes monolithic and boring for people. It has to be relevant, it has to develop, it has to take account of different needs. One of the things about it is that it's noticeably become more international in its appeal, partly because we've gone through a process of learning what the needs are of students are in different parts of the world, and we've learned an awful lot. We've learned a heck of a lot from my knowledge of the Swiss health system, and the issues around sexuality and race within South Africa have gone off the scale in terms of learning. But even more than that, we've learned from an awful lot of students about where they are, what they're doing, and how that relates, and we've amended the program accordingly. We've adapted the program to meet their needs.
And just a second, one of the comments that Anne had said quite rightly. So we have responded to feedback to try and give more sort of future planning with dates and things. And I think some of the students in the later years would, I hope, say that we've given them more warning, because again, we want the feedback, and we're really delighted we get it so that we can respond to that, because we are trying to work with different time zones and different ways of learning. Some people love being on Teams and putting comments in, some people that's really not for them. But I think what we've allowed is people, I think learning styles were a very traditional way of looking at things, that these are the different ways you learn and that's it. But actually we've got into, exactly as Craig said, he's an individual practitioner, he can manage and set his schedule. Other people have got less freedom to do that, but you're all adult learners, so we respect that. So we obviously, you need to do assignments, but how you choose to interact is what works for you, and everyone's different, and that's fine too.
That's excellent, thank you. Are there any live sessions? Is the material all online and pre-recorded?
The vast majority of the material is online and pre-recorded, and the reason for that is that that allows students to be able to access that whenever they need it, and that's partly to take cognizance of the fact that students have very different needs. Some may be on shifts, and we do have students who are working shifts at the moment. We do have students who are very far in the Far East and some in the very far West, and therefore time zones mean that it's sometimes very difficult. There are regular live sessions through the so most of the tutorials, well, all of the tutorials and seminars that we run, which are mostly alternate weeks, but slightly more than that. And each of the programs are live, and all of the supervision for the dissertation, which is very much ad hoc. So some students need, perhaps depending on the methodology that they use or their confidence academically, will need more supervision than others. So that's very much ad hoc, and that's all live. So it's a mix.
Great. Can students come onto campus to graduate, even when they're online students?
Yeah, we would very much encourage that. Our first graduation last year was absolutely fantastic. It was, unfortunately, you can actually, usually graduation is in December. You can defer that to the summer if you want a slightly less risk of rain. Glasgow is in the west of Scotland, and therefore gets an awful lot of rain, unfortunately. So, but you're much more likely if you graduate in July. So there are 2 graduations a year, but usually graduation is in December. We had our first graduates last year, and that was a very, very special day for us, partly because it was the first time we got to waltz down the middle of Bute Hall wearing gowns, but also it was a really joyful celebration for the students that graduated, and we got to meet a very eminent member of the legal profession, Lady Ray, who's been a great help to us since then, and has offered her help with the program. And we met all sorts of other people, and we had a great time. And yeah, so we would encourage that. I have to say, credit goes to Craig for the student who's come the furthest to come and see us. Craig, bless him, came however many thousand miles it is from Joburg to have coffee with me on a very wet morning in Glasgow, and we had the most wonderful time just chewing the fat. So there are students who will come, more than the Proclaimers 500 miles to come to Glasgow to see us. But yeah, you are very welcome. You would be encouraged, cajoled to come to graduation, because it is a brilliant day in the neo-Gothic Bute Hall. You can, if you go onto YouTube and look up Glasgow Medical School graduation, you will see previous iterations of Glasgow. It's a very traditional graduation, but it's a great day.
And they've actually, the university, have opened it up, my understanding, so that the postgraduate certificate and diploma students can also come and graduate, not just the master's students, which is a new development this year, which we're really excited about.
That's lovely to hear. I know it's a shame because we have such a beautiful campus, and our online students must see all the pictures and think that looks like such a wonderful place, and then you get to visit at the end of it. Also, if we do have any local students that are local to Scotland or Glasgow, you can get a student card and you can access our campus and facilities, and you're more than welcome to do so. The university grounds are open 24/7. So yes. Craig, would you like to say something? Sorry.
I'd just say one thing before Craig, about student cards and things. Do get a student card, because in some places it doesn't matter where you are, but your student card will get you 10% off the cinema, which my teenage son felt was appalling when I presented it in my 50s when I was doing a master's. So yeah, so you can get 10% off at the cinema.
I will say that the student discounts are much better in South Africa, apart from the fact that everything is much cheaper anyway. But you mentioned that if you're a student locally, I went on campus and worked for a week out of the library in Glasgow when I went there, and I was welcomed with open arms. It was not a battle, and I was issued a student card very easily, and it was a lot of fun.
Yeah, we definitely encourage it. It's lovely to see our students from online be able to come onto campus. So yeah, it is lovely. I think we've got time for another question. Is there a good link to move on to a PhD from this programme if you complete the MSc component?
I would say very much yes. We have a link with our colleagues in NVLS. So in fact, one of the teachers on the research methods course, Professor Bridget Johnston, has a very active program of PhD students who she would very much welcome discussions with about taking further forward if that were the case. But I would, and part of the research methods course is to make sure that you're familiar with research methodology. I suspect that we'd be able to negotiate some demitting of, if students did go forward from this program, they'd get some time off the research methods they have to do as part of the PhD program, which is a much more structured program than it used to be. So the short answer to that is yes, we would encourage that. And in fact, part of the conception in terms of the presentation when I first took on the post was that the best dissertations would end up as PhDs, not necessarily through Glasgow, but we would encourage you, and we have links with the relevant academics who would be able to take that forward. I'm not a PhD supervisor, so I couldn't do that, but I would encourage anyone who was thinking of doing that to do that.
That's great. Thank you so much. I think that's all we have time for today, but just want to thank everybody for their time, and thank you to everybody who's attended today's session. It has been recorded, and I will subtitle this and upload it to our YouTube channel, and also email it out to everybody who has registered for the event. If there are any questions and you didn't watch live, please feel free to reach out to us. We do have an email address on our programme webpage. So if you do have any queries, anything about your application status, please just reach out to us and send us an email. We're more than happy to help you. But yes, thank you again for everybody for attending today.